In the world of healthcare, documentation is paramount. But there's a charting mistake that's alarmingly common and potentially career-ending. Today, we're diving into the dangerous practice of copy-pasting old notes without updating the patient's condition. Imagine this scenario. A nurse, rushing through their shift, decides to save time by copying yesterday's notes for a patient. They quickly change the date and move on to the next task. Seems harmless, right? Wrong. This seemingly innocent shortcut could have dire consequences. The problem arises when a patient's condition changes, but the chart doesn't reflect it. Let's say a patient was stable yesterday, but today they're showing signs of deterioration. If the nurse simply copies yesterday's note stating patient stable, they're creating a false record of the patient's current state. Now, consider the legal implications. In a court of law, medical charts are treated as legal documents. If a patient's condition worsens dramatically, or they even code hours after a note claiming they were stable, the healthcare provider is in a precarious position. The discrepancy between the documented condition and the actual patient state can be seen as negligence or malpractice. This isn't just about avoiding legal trouble. It's about providing the best possible care for patients. Accurate, up-to-date charting ensures that all healthcare providers have the correct information to make informed decisions about a patient's treatment. So how can we avoid this potentially license-revoking mistake? The answer is simple but crucial. Always document what's happening now, not what happened last shift. Take the time to assess the patient's current condition and record it accurately. If there are changes, no matter how small, note them. If the patient remains stable, still perform a new assessment and document it. Remember, your license and your patient's lives are too valuable to risk for the sake of saving a few minutes. Proper documentation isn't just about following rules. It's about protecting yourself professionally and ensuring the best care for those under your watch. In conclusion, avoid the temptation to copy-paste old notes. Always provide fresh, accurate documentation of your patient's current conditions. Your career and your patient's well-being depend on it. Stay vigilant, stay accurate, and chart responsibly.